So good morning, everybody. Thank you for joining us today. This is really our fourth webinar, I think, scheduled in the series for our COVID-19 management webinar series. We've had a series of 3, that we have one tomorrow. We'll talk about that one as well. But today we're excited to talk about OSHA guidance. So we're talking a little bit about the federal perspective on COVID-19 management. My name is Dean Young. I'm the Vice President of Industrial Development for GenEdge, so I work with our field organization and our marketing group, and I'm kind of be running the webinar. Then I'll introduce you to the real brains of the operation here in a minute, April Schmidt, who's our Practice Manager for Organizational Development, and our guest speaker, Holly Singleton, is going to give you some great information on OSHA guidance. So for those of you who aren't familiar with GenEdge, I'll give you a quick spiel on who we are. GenEdge is a political subdivision of the Commonwealth, so we are an economic development organization within the Commonwealth focused on helping manufacturing, engineering, and technology businesses innovate, compete, and grow. So our charter is to help those companies become more competitive, to help them drive revenue and ultimately high-paying jobs within the state. We are an affiliate of a federal program through the Department of Commerce called the NIST MEP National Network. This is a program that funds an organization like us in each one of the 50 states and Puerto Rico. So we are that affiliate for Virginia and DC. And what we do is really provide management and technology help to those kinds of companies that we serve to help them increase their core competency and to help them where they have shortages or gaps in their own resource set internally. We have about 30 direct employees. We're headquartered out of Martinsville, Virginia, but we are spread across the state. And we have an extensive network of really high-quality third-party providers. So we work a lot with other small businesses in Virginia to help provide the services that we do for the clients that we try to help grow. We typically engage through some sort of an assessment model, and we have a variety of different services, as you can see here. Each of these folks, each of these practices is headed up by someone like April, you'll meet in a minute. And they help us really understand where to go with each one of those areas and what kinds of subject matter makes sense for the companies that we serve. We are across the state, and you see kind of the map behind this. We are regionally located as well. So we have folks on the ground in each of the regions of the state to try to help the companies in that particular region really get to understand who's who in the zoo there, if you will, and understand how to focus that delivery. So we've got the ability to reach back nationally through that MEP network and regionally through our local resources on the ground. So really we're interested in helping those companies grow. Everything we do is based off of results. So we're measured based off the impact that we provide. And in order to do that, that means that if clients don't help get impact, we're not winning. So while we provide consulting services, at the end of the day, we still are here to help those companies grow and ultimately the economy of Virginia grow. So I'm going to turn it over. I'm going to introduce April Schmidt. April is our practice manager for organizational development. So I'm going to let her talk a little bit about what we're going to cover today and then let her introduce Holly, and we will get into what you guys are really interested in hearing from, and I will stop talking. So thank you for joining us, and April, take it away.
Good morning, everybody. As Dean said, I'm so glad that you're able to join us this morning. We will send out a copy of this recording and to you later today or tomorrow. Please make sure that you check your junk or spam folders for that email, because it may end up going there instead of your inbox. We will also do a short poll at the end of this webinar that will take you 60 seconds or less to complete. If I could ask that you take that time just to provide us some feedback on today's webinar and the content, that would be extremely helpful to us. Now, in talking about having our presenter today, Holly, I am extremely excited, and as Dean had mentioned, the power of our network. This is a tremendous example of being able to highlight that collaboration between centers. Holly is coming to us from North Carolina, where she is the Assistant Director of Health and Safety Services at North Carolina State Industrial Expansion Solutions. So she gets the opportunity to manage the services of that team and those environmental and health and safety experts. And I know Holly has a tremendous amount of content to cover today and that's the real reason why you're here listening. And so I will turn this over to Holly to be able to review with us OSHA and COVID requirements.
I do have the slide up. Y'all can see the slide that I'm sharing?
Yes, we can.
Excellent.
We can.
I appreciate that feedback. It's not unusual for me to get started and someone say, we can't see your slides. So I am Holly, and just a little bit about the connection between IES, which is where I work, and Gen Edge. Essentially, I work for the North Carolina iteration of Gen Edge. We're called IES, but we are the North Carolina MEP, the Manufacturing Extension Program. And our MEP is blessed to have as a part of it the OSHA Training Institute Education Center. And technically that's really where I am anchored. So as Assistant Director of Health and Safety Services, I am part of the leadership of the Southeastern OSHA Training Institute Education Center. So that's kind of my expertise and what I bring to today's discussion. I do want this to be as much a discussion as anything, and invite those of you that feel comfortable being on camera, flip those cameras on and we can have a discussion and be face to face and really enjoy spending some time together. So as we get started, a couple of things to share with you. Thing number one, I'm going to put in chat. So I always have trouble pointing and clicking and talking at the same time, but I'm going to put something in chat here for you guys to grab. And hang on just a second. Did I mention I have trouble pointing and clicking and talking? All right, it is not set up to let me do this. So never mind that approach. I have a document that I am going to share. I'll show it to you right now because I do want you to understand kind of how this is going to work and what you're going to receive before everything is said and done. All right, so can you see this document now? It says OSHA guidance during COVID-19, and it's got some links on it. I'm going to make sure that you guys get this because the links are numbered. So you see that the numbers on this, I think there's about 10 or so of them. As we go through my planned discussion, you're going to see references on the slides that have a number, and we're going to give you a copy of the slides too. And the number in the corner is designed so that as you look at that slide, if you have the thought process of, I need to understand this better, or I need a little bit more information, that number corresponds to the resource on this list so that you could then go and find out as much information as you might desire and maybe more. So I just want you to know kind of that's how it's designed. So if we're talking about something and in your mind you're like, man, I want to see this for myself, just make a mental note of what number is on the bottom of the resource on the slide, and then you'll be able to correspond that to take a look at the resources that I'm providing you on that sheet. I'm going to try one more time, see if I can. Yeah, it's not going to allow me to attach that. That's okay. We'll get beyond that. All right, let's take a look at what we're going to tackle today. Just a couple of kind of basic things. Thing number one, we are going to be looking at OSHA's standards. Now, this is different than looking at your state, Virginia's new standard. I think you'll be pleased to know that basically, if you're in compliance with Virginia's new COVID-19 standard, you are in fine shape with what federal OSHA would like for you to be doing. So that's the good news. We're also going to look very briefly at kind of where employees' heads are and how you can put a finger on that pulse. We'll be taking a dive into what are some of the risk reduction methods that we can employ, some of which are required by OSHA as well as the Virginia standard. And then in your Virginia standard, it does indicate that you need to have a response plan. And so I'm going to give you some more guidance on that. I know Virginia provides, what I would say is kind of a recipe. It's not really a template, but it's a great document on Virginia's Department of Labor website that walks you through, okay, what what does the response plan have to include, I'm going to give you some additional resources on how to pull that together. And then at any time, if you have comments, questions, I invite you just to jump in, turn your audio on and say, hey, Holly, what about this? Or here's what we encountered and what we found to be helpful and successful. So jump in anytime. If you're not comfortable doing that, please use chat and just send your questions. I think April and then maybe Dean also can monitor that. And April and Dean can holler at me and say, Holly, you've got a question in chat. So y'all just make this yours is kind of the bottom line. All right, so you guys know all about Virginia's situation. You're in alignment with that. Lots of good information in that standard. And the good news is, if you're solid with Virginia, then you are solid with federal OSHA. But let's look at some of what federal OSHA does say. And this is not new information. This is not COVID specific. So these are reminders that some of what you've always been required to do applies to our COVID scenario. So looking at OSHA's standard on personal protective equipment, so this is 1910.132, it literally says that when workers are exposed to hazards, we as employers must conduct a hazard assessment and must determine if PPE is required. So that is probably something that you have done, related to machine guarding or lockout tagout or chemical safety. There's all sorts of areas and arenas that this standard would apply. And you ask the question, is this employee, by virtue of their job, exposed to any hazards? And if the answer is yes, then you work your way through, well, can we get rid of that hazard? If you can't, can we design things to protect the employee? And if maybe you can, but not fully, I can't protect them 100%, then you eventually get down to, well, does this employee need to wear PPE? Well, OSHA says you have to do this regardless of the hazard. So if you've not taken a look at the hazards related to COVID-19 or infectious disease and how the PPE standard applies, you might need to thumb back through that and go, okay, what are the hazards and do we need to do anything different? Another standard that you are familiar with, HAZCOM standard, also has its fingers kind of wrapped around some of the COVID-19 stuff. So HAZCOM is all about what? What's the point of HAZCOM? All right, y'all talk to me. What's the point? Why do we have a hazard communication standard? All right, now, if y'all showed up just to sit here in front of your computer and listen to me just drone on forever, that's not my plan. So I want a conversation. So what's hazard communication about?
It's to let employees know of hazards in the workplace, chemical hazards that they may be exposed to.
Exactly, Robert. Thank you. So it's about chemical hazards.
Right.
So COVID-19 is not a chemical, right? So it doesn't apply.
Yeah.
But Robert says.
I mean, it isn't so much as everything on Earth is a chemical.
It's funny. There's a guy that that speaks to that. Very old dude from 400 BC, and he speaks to the fact that everything is potentially hazardous, and it's not about what the substance is. It's about dosage. That even water can be a hazardous chemical. But in terms of HAZCOM and what OSHA says about HAZCOM and how it relates to COVID-19, it's really centered on the question, are your employees using new chemicals? Because it is a chemical standard, and COVID-19 is a virus, not a chemical. But if you have brought in new cleaning supplies to disinfect or clean tools or surfaces, then the HAZCOM standard is saying you need to evaluate those new chemicals and you need to determine if your workers are being exposed to a new hazard based on the chemical. So where do you get that information? What do you need to be looking at to determine, are there new hazards and things we need to be addressing?
The SDS is a great place to start.
It is perfection to start with the SDS. So you're going to look at that safety data sheet and go down through it and be asking the questions. Does this chemical introduce a hazard to the people who are using it as a function of their job? Does this safety data sheet tell me that people using this chemical need to be using PPE? And the answers to those questions might result in you having to go back and do some additional training under the HAZCOM standard. We have a new chemical, it's introducing new hazards. You guys need to understand how to use this chemical safely. So just be mindful of that, because I think there have been folks that have brought in those new cleaning chemicals and have not really given that element of the standard any attention, and we need to make sure it is. Here's a fun one. Now, do you see what I'm talking about at the bottom of the screen? See that number 3? And you'll see there's an OSHA enforcement memo related to recordability. So if you have questions pertaining to, does a particular coronavirus related illness need to go on our 300 log, there's some great information on OSHA's website. It will be resource number 3 when we get you that handout. So recording and reporting illnesses and injuries begins with answering the question, do we have a worker who has tested positive for COVID-19? And it is based on testing. And you would, let's look at it this way. If you're responsible for, on a regular basis, determining does a particular illness or injury need to be put on our 300 log, then the very first question that you ask is there an illness or injury? That's question number 1. And you'll find that in 1904, 29 CFR 1904, and it gives you kind of a step-by-step, here's how you figure out if a particular illness or injury needs to be put on the 300 log. And step number 1, literally the question is there an illness or injury? So with COVID-19, you begin there, and the only way you can answer that question is that you have a confirmed case. You have a positive test result. So if you have a positive test result of someone within your workforce, it doesn't automatically go on the log, because you then go to the next question. And we are simply applying the normal approach under 1904 to figure out if it goes on the log. So the next question is this case work-related? Right. Now this is a little more complicated and a little more difficult sometimes to discern, but that enforcement memo is really helpful. So OSHA is saying in their enforcement memo, and you can find it in resource number 3, that a COVID case is likely work-related if, and you'll see the 3 bullet points on the screen, if you have multiple cases within your workforce and there's no other explanation except that it kind of traveled through your workplace, you have known exposure to a customer or a coworker in the workplace who's positive, or the job duties of that worker include exposure to the general public where there is ongoing community transmission. So in other words, if someone comes to work, and are any of you guys using like screening when folks arrive to work? Are you doing temperature checks or questionnaires?
Temperature checks.
Temperature checks. And y'all can give me, if you don't want to turn your camera on and talk to me, you can give me a thumbs up. You can put in chat, yes, here's what we're doing. But anybody doing stuff?
We do both.
Both? Right. So if you have someone come in and let's say they have a fever, let's say they check out at 100 degrees, you're likely not going to let them come into the workplace, right?
Correct.
Right. So let's suppose that that person, you're going, nope, you can't come into work today. They end up getting a test and they're positive. Right. Question number one, let's go back to this slide. Do we have a confirmed case of COVID? Yeah, right. They left, they got tested, and now they call you and say, hey, you ain't gonna believe this, but I just tested positive. Well, then we go question number two. Is it work related? And this is where you apply these three questions. And if you discover, well, you know what, they've got a college student that lives at home with them, and the college student and several of their friends have been positive over the last week and a half, then you're going to operate under the assumption, unless you have other information, that they got this within their family. And you will likely be able to conclude that this was not work related. So just because they showed up, they had a fever, and then they subsequently tested positive does not mean that you've got a work-related COVID case. Now, here are some things on the screen that says it's likely not work-related. And that is if you have just a single worker and they don't have any job-related contact with the public, or you've got a worker who has had community contact, whether in their home or in some other arena, and that's where they got it. So if it's not work-related, you're done. It doesn't go on the log. Now, if it is work-related, then the next question, I'm going to go back to this right here. The next question is, does it meet any of the general recording criteria? And those are outlined in 1904. Well, if they've tested positive, you've determined that it's work-related, which of the general case recording criteria is it going to automatically meet? Do y'all know what those criteria include? All right. Number one on the list is, did the worker receive medical treatment beyond first aid? All right. Another one on the list, did they miss work as a result of this illness? You're going to say yes to both of those, right? A yes to either one of those puts it on the log. So if you have a work-related case, it's going to go on the log because they're going to miss work and they're likely going to receive medical treatment beyond first aid. Now look at that second bullet point. Let's suppose that that worker ends up being hospitalized. Well, the OSHA standard says if you have a hospitalization as a result of a work-related illness or injury, you have to pick up the phone and call OSHA and tell them about it, right? Yes, that's right.
Yes.
Except the standard in 1904 says the hospitalization occurred within 24 hours of the exposure. How likely is it that your COVID positive worker is going to be hospitalized within 24 hours of their work-related exposure?
Low to no.
Low to no. So very likely they would not be hospitalized within 24 hours. So very likely you would not have to report. So report means pick up the phone and call OSHA. Nonetheless, it would go on your 300 log. So you would still have to maintain that log. And the same thing applies with death. So if you had a worker who died as a result of COVID-19, the question is, did they die within 30 days? There's nothing that drives me crazier than a typo on a slide. And that should be work-related exposure, not ORC-related exposure. So if they die within 30 days of exposure, yes, you pick up the phone and call OSHA. If it's beyond 30 days, it simply goes on the log regardless of the timing. Any questions related to recording or reporting COVID-19?
I think the fuzzy part of this is determining work-related exposure, because if you have a large facility with people spread out all over the place and you get the onesies, twosies that of course are in the community when they're not at work, and there's no like outbreak within their work area involving multiple employees, you could say, well, that's not likely to be work related. However, if you had like a department where a group of people tended to work closely with each other and you had 2 or 3 cases there, you could say that's probably work related. So it's fuzzy.
Yeah, Robert, unfortunately, it is fuzzy. I would encourage you, if you have questions, to read that guidance document. It does provide a little more detail than what I've provided on the slides,
Okay.
but it doesn't clear up all the fuzzies. And if you've been doing OSHA for any length of time, you know that there are always fuzzies. It just seems like many answers to OSHA related questions begin with the phrase, "it depends." And there's just so much that is sometimes in that gray area. But I will tell you, as someone who works pretty closely with OSHA, if you are doing your doggone best and you look at the guidance and you apply it the best way that you understand it's to be applied, I don't think you're going to get punished for that.
Right.
But there are many people who look at that guidance and they try to figure out, what can I do to get around it? And that's not going to end well. But take a look at that guidance document. I do think you'll find some clarity, but I'm not going to promise it's going to get rid of all the fuzzies.
Right. I want to mention again, I work closely with FDA regulations. That's really my bag. And whenever there's a guidance, the guidance is stuff like a best practice or an interpretation of the standard, but you don't have to comply to it because it's a guidance. Is that the case here?
Yes, but yeah, I'm going to say yes, but. Now you'll notice when I was talking through how to apply the 1904 to COVID, that's very driven by the standard.
Sure.
Do you have a confirmed case? Is it work related? And does it involve any of the general case recording criteria? So all of that is very clear and black and white. Where you get the fuzzies is determining if it's work related. So that's really where the guidance is. So applying the standard is not guidance. That's standard. That's how we do it. But figuring out, okay, is this individual case work related or not? That's when I want you to dive into that guidance document and try to apply it as best you can, understanding, as Robert said, that it's guidance, and you may have a scenario that's kind of really weird and over here a little bit, and you look at your scenario and go, I'm not sure that this really fits what OSHA is trying to say, but let me try to discern as best I can how to move this forward.
Very good answer.
And also, don't hesitate to call OSHA. I know many of us don't believe that OSHA is our friend, but they really can help with trying to help you apply the guidance to your scenario. And you are welcome to call us at Southeastern. Technically, we are Region 4, and you guys are in Virginia are Region 3, but hey, we're neighbors. We're all friends. So don't hesitate. If you have a question for our crew, we've got a great group of professionals who can help you also look at that guidance and apply it to your scenario. Excellent question. Thank you. General duty clause, let me just say, even in the absence of a COVID-19 standard, the general duty clause applies. And the general duty clause basically says, when you have a known hazard, something that we are aware of as a potential hazard, then it's our duty to protect workers. So even in the absence of a standard that outlines kind of the here's step by step what you must do, you still must comply under the general duty clause. So don't lose sight of that one. All right, you guys know state plans can be more specific than the federal. Right now, federal OSHA does not have a COVID-19 standard. They have COVID-19 guidance. Virginia has a standard, and I will tell you, federal OSHA is looking very closely at your standard and considering, does at the federal level, does it behoove us to move toward having a standard? This is Holly's opinion and kind of where I think things are going. I think what we will see coming out of federal OSHA is something that's very similar to Virginia's current standard. But I think, not confident, I think it will be referred to as an infectious disease standard and not be tailored specifically to COVID, but will be much more applicable to whatever infectious disease we might be dealing with. Now, that's just my gut feeling, but there's much more coming on that. So I don't have a timeline for federal, but I think it's around the corner. All right, you guys know this particular slide is just simply there to remind us that we have responsibilities regardless of the hazard. But let's look a little bit specifically at COVID. I want you to see this particular pie chart. Now, OSHA has received thousands of worker complaints related to COVID-19. And this began probably in around February of 2020. And I'm talking thousands. Now, what you're seeing on this particular chart is a snippet. So this is just, I pulled a recent 2-week period, which represented about 300 total complaints, just to see kind of where are people's heads? What are they complaining about? And you'll see that probably some very predictable issues on this pie chart. The biggest segment of that chart, almost half the complaints, are anchored on people saying, my employer is not doing what they need to be doing. They don't seem to have a plan. I don't feel like they've really done the things that they need to be doing. So that's, I think, really important, because if employers had that plan in place and were implementing the protocols and the policies and procedures, I think you would see the other half of that pie chart also shrink. And that's just a guess, but that would be my opinion on that. So let's look at how to reduce risk and ensure people's safety. This is old news. Hierarchy of controls. If you're in safety for 30 minutes, you've stumbled across the hierarchy of controls. And it really, if you're not familiar with it, it's basically saying, once you've identified a hazard, number one question is, how can I get rid of it? What can I do to eliminate this hazard? Now, as an employer, you're going to encounter hazards that you can't eliminate, at least not 100%. You might be able to do, some reduction, but there's probably going to be some leftover hazard. So number two is, okay, I did what I could do to get rid of it. Now, what can I do to engineer it out? How can I separate the hazard from the worker through engineering controls? Then you come down to, if there's still leftover hazard, are there administrative controls I can put into place? Are there policies and procedures and things that I can do administratively to protect workers? And then the very, very, very last thing is, if there is still some hazard left, okay, what PPE do people need to use? Now, here's the critical piece about this hierarchy of controls. It ends with PPE. It does not start with PPE. And that's the mistake that many workplaces make. They identify the hazard and then they distribute the PPE, when they need to be going, okay, here's the hazard. How can we eliminate it? How can we reduce it? How can we do things that are going to enable people to be protected, before we rely on them to use PPE every time and use it correctly. Because the top portion of that triangle, those engineering, elimination, engineering, and administrative, those are going to be more successful, because once you start relying on people's behavior, it kind of goes out the door pretty quickly. Engineering controls for manufacturing. I want to share with this. This is resource number 6 on the form that you're going to receive. And it speaks to distancing and barriers as engineering controls. And it's going to give you a little bit more guidance on how to accomplish this. But let me throw a question out there to you guys. What are you doing? And what are you doing in particular that you feel like has been successful with regard to engineering controls with COVID-19? Turn those microphones on and tell me what you've been seeing in your workplace. Have any of you been successful at distancing? I'm going to give you a different question. What headaches have you run into? Have you run into aggravations with trying to distance and provide barriers? Yes, Mr. Turner.
Distance has been a slight challenge, but you just have to get a bit creative, widen some desk space up, or have team members instead of 3 and 4 foot apart to mark it off so they can be at least 8 to 10, to make sure we're well within the 6 foot. So there are always ways. You just have to look differently and get a little bit more creative. And also the physical barriers, the plexiglass in between, that helps too. So there are ways.
But like you said, yeah, there are ways, but there are challenges too.
There are challenges. That is correct.
Anybody else have success or headaches that you would be willing to share with us?
Holly, one big challenge with some of the clients I have is riding in vehicles together. And so, having to deploy more vehicles so that folks feel safer. They're not crammed in, 4 or 5 in a vehicle at times. So that was definitely challenging at the onset, and something that still remains a challenge today.
Yeah. Yes, thank you, Alex. And that is something that's specifically addressed in the Virginia standard about riding in the vehicles and keeping people safe. We have had a lot of challenges working with construction companies where they're piling, 6 people in the cab of a work truck, and then, a week later, all 6 of them test positive. It's a very, very enclosed space. So if you have one person in that vehicle who's positive, everybody's likely going to become positive. So that's a huge issue. Any other headaches or successes?
I'll just say the other thing that I think has made a big difference is asking employees exactly what makes them uncomfortable. And sometimes we think, hey, let's figure out in the conference room what we can do to keep our employees safer without taking their perspective into account. So they might be the best people to start with.
Alex, that is absolutely huge. Absolutely. You will learn so much engaging your people in that conversation, and they will come up with solutions that perhaps, like Alex said, in the boardroom and in the meeting, we never think of, and then they have the perfect solution for things. So yes, great advice. A couple of other things to be mindful of, because I know in some manufacturing settings, it's not a comfortable environment. And now here in the winter, when we have 30-degree temperatures, 40-degree temperatures, we're probably okay. But as those temperatures rise, and people are like, it's hot in here, we need to put up these fans. And many times people will just have their own little access to a fan. Be aware that how that fan is set up and how it's blowing is important. And if it's blowing across, if it's providing that flow of air across several workers, that's probably not the best idea under the current circumstances. So you want to make sure that you're not blowing from one worker to the next when you're using fans for added ventilation. A lot of the other things listed on the slide are specific in your Virginia standard, as well as some of these administrative controls, signage, policies, health screening. This is old news that you guys are very familiar with. If you have questions, don't hesitate to ask them. But let's spend a few minutes on PPE, face coverings, masks, respirators, and that sort of thing. So most states do currently have in place some either mandate or recommendation that people wear face coverings. And we all have to comply with whatever's in place for our state and local municipalities that might have these mandates. So some things to be mindful of is face coverings don't protect the wearer. A face covering protects the other people around that wearer. For the most part, all your employees should be able to find a face covering that will be wearable by them. And by that, I mean, there are provisions in these mandates that say if for health reasons someone can't wear one, then they don't have to wear one. What I am trying to convey to you is there should be some approach that's going to work for everybody. Even folks who do have any one of a variety of health conditions that might make it that they can't wear a particular style. There's likely a style that they can wear safely. Be mindful that a face covering, a cloth face covering, is not PPE. Now, once we get into the arena of PPE, things change because OSHA has a PPE standard. So once we start having workers wear personal protective equipment, we have to comply with the PPE standard. But a cloth face covering is not PPE. It's designed to protect other people. PPE is designed to protect the wearer. So does that make sense?
Yes.
So there's no OSHA standard that you have to comply with just because your workers have to wear a face covering. Now, they come in all sorts of arrangements and all sorts of styles. I do want us to touch on just briefly, in a manufacturing setting, what are some of the problems that are being encountered with cloth face coverings? So what have you seen and had to tackle or deal with?
Well, they get occluded by dust over time.
Yeah. So dirty environments can be a problem.
Yes.
If the face covering becomes dirty, it needs to be replaced with something that's clean.
One of the things that we see quite frequently is we require safety glasses in all of our manufacturing facilities and areas. And with the cloth or any kind of face covering for that matter, it's been a task to find any type of safety glass that is anti-fog. I know a lot of companies want to brag that they have anti-fog lenses, but that's not necessarily the case. So that's one of our major battles, because that in turn creates another hazard.
Absolutely. Not to mention the fact that it gets on my last nerve when my glasses fog up because of my mask. Has anyone found a solution or something that you've been successful with preventing safety glasses or other regular glasses from becoming fogged with a mask? I can't recall the name of it off the top of my head. There is a like a liquid that you can purchase that you kind of rub it on the lens of the glasses that I've had some success with. So it's not a special safety glass. It's a bottle of liquid that you put on a cloth and rub it on the safety glass lens that can temporarily help with the fogging. I don't recall the name of it. I can look that up later though. Any other aggravations or success stories with masks wearing? Just keep in mind that wearing the mask is a public health and public safety issue, but wearing a respirator, that's then PPE. So if a cloth face mask protects others, a respirator is designed to protect the wearer. And if you are requiring someone to wear a respirator, then now you're going into 1910.134, which is the respiratory protection standard. And I'm going to break out of this PowerPoint for just a second and see if I can quickly bring something up to show you. I'm going to stop. I'm going to stop the share and try to find something really quick because I think, okay, hang on. Yeah. Okay. I was really trying to come up with this. All right, so I'm going to share again because I did find the right screen. This is OSHA's website, and this is all about, COVID-19 details. But what I want to show you, I want to make this a little larger so you can hopefully see it. If you look at inspections with COVID-related citations, I want you to see where the majority, can y'all see that good enough to kind of see some of what's going on? So we have, gosh, I don't know, see if I could find a manufacturer, but all of these seem to be health care. A lot of these are healthcare related. Here's Altman Specialty Plants. That's a manufacturer. Now, the citation for this is 1904, which means it's what type of citation? 29 CFR 1904 is your record keeping standard. Yeah. Now, if you look at what else is showing up pretty regularly, you will see a lot of 1910.134. Do you see how often that one is showing up? Make it. Whoopsie, too big. Y'all see how often 1910.134 is showing up? What's that standard?
The ordered roll material.
That is
It's not in the system.
the respiratory protection standard.
Well,
So, Mr. Blackwell, is that who we're hearing? Who?
Oh, okay.
Yeah, we're hearing some background noise from one of our participants. If you want to mute, that might be helpful. So my point in showing you, kind of where, whoopsie, hang on just a minute. Get back to the slide. The majority of problems that people are encountering when it comes to citations is either record keeping or respiratory protection. And what we're seeing is workplaces that are requiring workers to wear N95s, that's a respirator, but they're not following the respiratory protection standard. And anytime you require a worker to wear a respirator, you must comply with the entirety of 1910.134. And it is a very complex standard. It requires medical evaluation, fit testing, training. There's all sorts of things that you have to have a written program. So be mindful that if a cloth face covering or mask is sufficient, stay with that. Because if you put people in a respirator and you're not in compliance with the respiratory protection standard, then you're up against the possibility of being cited under the respiratory protection standard. Any questions about
Yeah, that's kind of tough right there, Holly. The only reason that we require cloth masks, we would say wear a cloth mask and that will be suffice. But if someone has either a dirty one or doesn't have one, what happens when the only thing you have to replace it is a N95 or a KN95 mask?
Yeah, it's an excellent point. So N95s and KN95s technically are respirators, so they fall under that respiratory protection standard. You can employ the voluntary use approach, which with an N95, that eliminates the medical evaluation. It also eliminates the written program as well as fit testing. So that's an approach that you could use. What I would suggest is to get your hands on just those simple little dust masks that are sold everywhere. Right, so do you see, y'all see the respirator, the N95 that's on the screen here? It's not that different from what you can buy at literally Lowe's, Home Depot. You can certainly order them online, that are dust masks, but not respirators. And typically, all right, this is not a, what I'm about to say is not a standard, but it's extremely typical. If the mask has two elastic bands, like this one does, so you have this band, can y'all see where I'm pointing? And then you have the second band here. So one goes kind of around the neck and the other over the head. If it has two elastic straps, it is very likely a respirator. If it says NIOSH, N-I-O-S-H, it is a respirator. And if it's a respirator, you must comply with the respiratory protection standard. However, if you get a mask that has a single elastic band and it does not have the word NIOSH, then those are just masks that can be distributed without any compliance with any standard because they're not respirators. Is that helpful at all?
Somewhat. You know,
Okay.
it's kind of tricky when it's not required, and you give that to a team member to use.
Yeah. That would be my recommendation. If it's not required, if they don't have to wear a respirator, then have some of those masks that aren't respirators. And they look very much like these. The other thing to understand too is if COVID-19 is the concern, do you see this little, can y'all see where I'm pointing? You see that little thing right there?
Yes.
CDC says that's a no-no if the idea is to protect from COVID-19. Because remember, wearing a mask for COVID is about protecting other people. And what is this little thing right here? It's an exhalation valve. So what does it allow?
It allows the free exhalation.
Yeah. And that's what you're trying to protect people from when you're wearing the mask for COVID. See, when you're wearing a respirator and you're required to wear a respirator, it's because that worker needs to wear something that protects them from the nastiness in the air. So whatever that worker is exhaling, we don't care about. We're trying to protect them from inhaling stuff. But when you're wearing a mask for COVID, it's all about the exhale. So having that valve on there defeats the purpose of the mask for COVID protection. Make sense?
Yes.
All right. Again, resource number 7, really good information on OSHA's website about face masks, respirators, and how they work and what they are and how to make sure that all is well. All right, we did that already. The other thing that you're going to find on your resource list, and I'm going to wrap this up, is some cleaning and disinfecting protocols. There's a really good resource on CDC's website. It'll be resource number 8 on your list, and it really prepares you for what to do with regard to cleaning and disinfecting. The last thing you're going to see on your resource list, I'm going to click through this really quick, is how to develop your plan. And this is an exceptional resource. So this is a checklist for preparedness. And I'm going to see if we can pull that up. Hopefully this will work. So this is a checklist that was developed by the CDC. And I'm going to scroll down just to kind of show you how it works. It's going to walk you through kind of, if you have a written plan, does it include all of these elements? Now, this plan, when you put it up against Virginia's standard, it's good stuff, because Virginia's standard specifies you have to have certain things in place. This particular resource, if you wanted to download and print it, and kind of you go through, kind of what are we doing? Are we doing it well? Yes, no, partial, what are the comments? It'll help you identify within your workplace, where are our gaps and what do we need to be doing in addition to what we're already doing. So again, that is going to be resource number 9. Is that right? Yeah, resource number 9 on your list. And then resource number 10 is the most up-to-date guidance on workplace exposure and the protocols that are in place. When can somebody return to work? And you'll see that these frequently get updated. So if you have that link, you'll be able to keep up with exactly what the CDC is recommending. All right, any questions about anything? I know we've gone all the way up to 11 o'clock on this, and I apologize, but any questions, comments?
You had something up there, CDC latest. I thought it suggested that if you have a coworker that tests positive and they're going into their quarantine, that anybody that worked closely with them, would they have to go into quarantine or?
Not under current guidelines.
Okay.
Excellent question. And it's one of those things that has continued to change.
Yes.
Now, you as an employer, you can tighten that up. And you can say everybody that worked, in this particular area with, Jim Bob, over the last 3 days, we don't want you at work. You can make it tighter, but right now the CDC does not have that in place. All right, April, go for it.
Well, first of all, let's give Holly a round of applause. Thank you so much for this great information that you shared today. You can use your virtual icons down at the bottom under reaction and do the hand clap, or you can do a little celebration. I know Dean has so graciously launched the poll for us. If I could ask that you take just a couple of seconds to answer those questions for us, that would be terrific. Holly has also dropped her email into the chat for you as well. So if you have additional questions, Holly is your go-to resource for that. Again, we have this recorded. We will send this out to you later today, along with a copy of Holly's slides and the document that she's referenced that has all of those fantastic links for you. We will also post that information on our website, and I know Dean shared in the chat a link to that information as well. We have a webinar coming up tomorrow with attorneys Hunter Burns and Stephen Gould from Burns and Gould Law Firm. This is a part 3. They are going to go over some information they shared in previous webinars about COVID vaccination testing, as well as we had some terrific questions come through, and it will be an open opportunity to ask your questions in relation to compliance with the permanent standard. We have also partnered with VMA, Virginia Manufacturing Association, for a workshop that will be held on March 9th from 11:30 to 2:30. We have a link there so that you could register for that workshop, and that will be going through in creating your infectious disease response plan and some of these other documents that are in the Virginia Permanent Standard as well. So if you're not able to attend tomorrow's webinar, but you do want the information, please still continue to register, because we will send out that recording and a copy of the slides for your review later on at a time that might be more convenient. I'm just going to go through and see. I saw a couple of questions come through the chat. Let's see. And I said Holly's email is there, so you can outreach her again if you have questions. Dean, is there anything that I am forgetting?
I don't think so. I think the question was, would webinar 3 be available as well? All webinars in the series are recorded and will be posted on the resource page. The first 2 are already there. This one will be up there later today, and then tomorrow you'll have the 3rd one as well. So I think all that information, the link I sent out will also be sent via email, but if you bookmark that page, you can continue to check back as we update it with new resources.
And I will also drop my email in there. One of the things too is we are here as a resource for you. And so if there are topics, content, webinar, things that we can do to help support you, please feel free to send me an email and let me know so that we can see if there's a way that we can help you.
Okay.
April, I will say we will have an online quick assessment, as well as we have the offer of, if you reach out to April or to one of your regional managers, we can schedule an on-site assessment as well to go through it in much more detail. Both of those are free of charge to help you figure out what you got to do to comply with the standard.
And feel free to reach out to me by email if you want. If you don't receive a copy of the slides or that resource page, I can send it to you directly. So no worries there.
Well, with that, I'd like to again thank Holly for her time today and a fantastic webinar and great information shared. If you haven't had an opportunity to complete the poll for us, I'd ask that you do that at this time. And thank you so much. And we look forward to having you join another Gen Edge webinar in the future.